Welcome to America's Heroes Group.
Welcome back to America's Heroes Group Roundtable with our partner, the Chicago Regional Office of Veteran Benefits Administration. July is American Diabetes and National Minority Mental Health Awareness Month. And today is Saturday, July 8th, 2023. Our host is Kelley. I'm your co-host, Debra Denhart, a U.S. Air Force veteran and host of Women Have a Voice program. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega, Scouts Honor Productions. And today on our panel, we have Justyna Berry. Justyna is a U.S. Army veteran who served in Iraq and currently the assistant coach for the Public Contact Team and Intake Processing Center team at the Chicago VA Regional Office. Justyna, thank you so much for being here today.
Hi, thank you so much for having me on this show. I'm so happy to be back. How's everyone doing?
Yes, doing great. How are you doing?
I am so excited to be here and just spread the word on PACT ACT and our events that we had and events that are coming up. I'm just super excited to be here.
Wonderful. So let's start off with what your role is going to be. This is our part 2 of our PACT ACT event coming up. What is the VA's role during these events?
So as you guys heard on the last show, we partner with the VA Health Administration to create these events in which a veteran could get enrolled into health care, they can get a toxic screening, and for the Veterans Benefits Administration, we assist them with filing a claim. They can also find out information about the current status of their claim and just in general, just get information about what benefits are specific to them.
That's wonderful. Now, are there, when we're talking benefits, right, there's always deadlines involved. And can you mention any deadlines that they should kind of like be aware of coming, along with the PACT Act?
Sure, of course. So the PACT Act was signed into legislation on August 10th, 2022. So anytime there's a change in legislation for Veteran Benefits Administration, they can go back 1 year in benefits. So what that means for veterans is they can submit their claim before August 9th, 2023, so they can be backdated to August 10th, 2022. So what that means for veterans is they should not wait until August to apply. If they are ready to apply, they should apply today.
Okay. Now, you know how deadlines come and go, right? And then you walk into the office and you go, oh, I missed the deadline. Are there any options for veterans who, that they're caught in that situation? Maybe there were health issues or they couldn't get to where they needed to be to make this happen. Are there any options for them if they do miss deadlines?
Of course. So, of course, with the PACT Act benefits, there's no deadline to apply because a veteran can apply for benefits at any time that they're ready. What I would advise veterans is in the event that they're not ready and they're listening to this show, you can always call the 1-800-827-1000 number. When you call them, you will speak to a National Contact Center representative, and you can tell them, I would like to file an intent to file. What that does is that preserves your effective date for benefits, meaning VA puts a note in the system that you have an intent to file. Then you have 1 year to gather your evidence and submit your application for benefits. So that gives people time to get their private medical evidence going. They can, find out more about how to complete an application. They can reach out to veteran service officers to obtain assistance in filing the claim. So it just gives them more time to file for these benefits.
So they can actually call the number and then just put on, I'm contacting you. So that can give them a year, 1 year, a full year to file their claim. Yes.
So there's another way to do it besides just calling the number. You can call, the first thing is you can call that number. Additionally, if you log into VAgov and set up an account, and if you just start your application but do not complete it, that also preserves that intent to file date. So that's also very important to know.
Yes, that's great. I mean, that gives them time. And sometimes you hear about these things and it's like, oh, I want to do that, but just there's no time. You just feel kind of rushed and you just don't feel like you have time to meet all the deadlines and everything that comes up. Has that happened? Do you hear that a lot with veterans?
Yes. And one tip that I have for veterans listening out there is throughout these events that we've been meeting with veterans, many times veterans, they don't go to the doctor for their ailments because, maybe they're not entitled to health care or they simply don't go. So what helps a claim is if a veteran, let's just say they have, frequent tinnitus, which is a noise exposure. And let's say they haven't gone to the doctor for that condition and they don't have it diagnosed. They can write a statement about their symptoms and submit it with their application. And that statement of symptoms can be used as one of the elements for service connection, which is the current evidence of a medical condition. Obviously, you cannot self-diagnose yourself with something such as cancer or something that needs to be diagnosed by a medical professional. But if you have, for example, like chronic tinnitus or an injury from service that's been chronic and that's been affecting your current living situation or, your daily activities, then you can definitely write a statement describing those symptoms.
So really quality of life, right? I mean, you're talking about, how, just daily. Like you can't make it to the refrigerator because your hip gives out or whatever. They could just make a list of like things that affect them daily, as far as their quality of life. And then some may apply probably, but some may not, right? But is it worth a shot to write everything down?
Yes, definitely. Because when the claim is received, they're looking at medical evidence. They're looking at, they're looking at your electronic files, so documents. So sometimes veterans just submit the claim without any supporting documents, and that results, in a denial. So anything to help paint the picture of what's going on with you, that will help.
Then, okay, great. Now, once they submit that, then they can set up an appointment to be evaluated, right? This is like the first step, right?
Correct. So, correct. Okay. So there are three things for service connection. So the first thing is that the event has to happen to you in service or an injury in service. Then you have to have evidence of a current condition that is shown by medical evidence or that statement that we talked about. Once you have those two, the VA will request an exam, and these exams are conducted sometimes by contractors, and they will determine if your current condition is related to service. Now, this is different for PACT ACT conditions because for PACT ACT, we have presumptive conditions. So the veteran, as long as they served in a location and they have the condition that is presumptive, they don't have to prove that it's related to service. So there's two different things going on here.
Okay. Right. Okay. So the list that we talked about in the previous program, the presumptive conditions. Now, could they be able to, when they stop by to the event, are those presumptive conditions, are there, information about those as well?
Yes, we provide information, and then also when they receive their toxic screening or if they enroll in healthcare, they also get more information from the healthcare providers. Okay,
great. Now, and with the PACT ACT event, which is awesome that this is going on, can you think of anything that kind of impacted you as well? I asked Robert the same thing on the last program, but just, something that you felt like, wow, that was amazing when you were at the event and you were helping veterans kind of decide if they, fell into the PACT ACT benefits, arena.
Yes. I actually do want to highlight one specific veteran that I was able to assist at an event, and he was a Vietnam veteran. He has never, ever filed a claim. And he was under the impression that he can only file a claim at this event. So I just want to put the word out there that you don't have to wait for these events to file a claim. Although it does help that we are in the community, but you don't have to wait. You can see a veteran service officer. You can come to the regional office. You can file online. So there are many options for you to file that claim. But this Vietnam veteran came to the event. He was suffering from homelessness. He was suffering from mental health conditions. He had diabetes that he was not treating, and he served in Vietnam. And diabetes is a presumptive condition of exposure to Agent Orange. So we were able to file his claim, and I'm pretty sure that as long as he has a compensable degree of disability, he will get benefits and he will have eligibility to health care and other benefits that he's entitled to. So it was just really special spending time with veterans and, you know, being out in the community, and especially on a Saturday, because some of these veterans are actively working. So being available, you know, when they're available definitely helps to get the word out.
Absolutely. And I think sometimes that's a little bit of a misnomer, that just because you're a veteran, that you don't have a job. I don't know why, but sometimes I get that impression when during those appointments, you know, being available, or just, you know, it just seems like, you know, no, I'm a veteran, but I do work full time too. You know,
Correct.
I think that's
Correct.
a preconceived idea. Do you feel that too sometimes?
Sure, but you know, veterans, they serve their time and then they have to go back to society. So we're just here to provide them with all the resources that we have, and you know, they can reach out to us.
Yes, that's great. What are some challenges you feel in filing? Have you seen any challenges, or just some challenges veterans should be aware of, but not maybe, you know, worry about? You know, sometimes you're
Sure.
filing some benefits. You know what I'm saying?
Sure.
You know, but don't be worried that may happen, but continue to do so. So if you could kind of explain some of those things.
Sure. There are a couple of things that I would like to go over. So the first thing is that veterans should know that they don't need to submit their service medical records or their DD-214 to file a claim. Since these are federal records, the VA will obtain these records for them. Additionally, I want to warn some veterans to be cautious of some companies who advertise VA benefits can only be obtained with their help. These companies may not be recognized by the VA and may be attempting to charge illegal fees. There is a website that they can check to see if a organization is accredited through the VA. It is www.va.gov/OGC/apps/accreditation. And you can search if that attorney, claims agent, or VSO is actually accredited through the Department of Veterans Affairs to assist you with that claim. We have seen some veterans that are being, you know, fished through email, social media, with aggressive companies who may try to pressure them to sign contracts or insisting that they must sign up now or they may lose their chance for benefits. So I don't want veterans to think that they have to sign up with these companies. They should look up to see if the person helping them is actually accredited.
Absolutely. That is so disheartening that there are companies trying to take advantage of veterans and pressuring them to sign up, you know, through them and scamming them.
Sure.
And getting their information. It's terrible.
Sure.
And that's happening.
There are plenty of accredited veteran service officers, agents, and attorneys who can help. And also our team, the public contact team, which we're located at 2122 West Taylor Street. We provide free assistance. We also have veteran service officers in the building who can assist for free to obtain these benefits. So definitely be cautious of companies out there, especially with this type of legislation.
Now, on that point of free, so if they're getting calls that we're charging a fee, basically, like you were talking about, just again to reiterate that, beware, right? Because there should be no fee charged.
Correct.
What type of? Oh, go ahead. Sorry.
If they suspect any scams or anything like that, they can definitely contact the VA Office of Inspector General, the OIG hotline. They can also file a complaint with the Federal Trade Commission because they should report these types of companies.
Absolutely. Wow. That's, yeah. So now I wanted to talk a little more about what you were talking about as far as information provided at the event. So can you take us through in the process of the filing, like what they can expect when they get there as far as the process of what you're going to go over at the event in getting their benefits?
So at these events, we have our public contact team, and we also have claims processors that assist our team in coming out to these events. So what the veteran can expect is they will walk into these, our next claims clinic will be at the VA clinic at Chicago Heights. So it's a VA facility. They just show up. They don't have to bring, they just have to bring an ID. They don't have to bring their DD-214 or anything like that. They will actually sit down with a VA representative where they will discuss their specific, case. So if they need assistance with PACT ACT benefits or any other benefits, we will be there to assist them. And what we do is we will actually provide them the form. They can either fill it out with us and we will, process the form for them, or we will provide that form for them and then tell them how to return it. But either way, they will get access to these benefits by these events.
That's great. Now, why would you encourage, or what are your thoughts on encouraging them to attend these type of benefits over like going to your office? Do you feel like, what are the advantages maybe of attending this in person?
Well, along with getting, the toxic screening or enrolling in healthcare, filing your claim, or getting assistance with any other VA benefits, we also have resource fairs. So we also have, I know the VA hospital, they had like whole health. They had various different resources besides just filing a claim for them. So there's just more information about the benefits that they have earned.
Okay, so beyond just the PACT Act is what you're saying, right?
Yeah, yes.
Other health, related issues. Yeah.
Yes, because we essentially want to get veterans service connected, because once you're service connected, it opens you up to other benefits such as veteran readiness and employment. It gets you healthcare benefits. So service connection is key.
Absolutely. Do you have any tips for anyone who may be frustrated? Say, I filed something 6 months ago and I went through these processes and then I was told I don't qualify. Are there anything that you could suggest to them, as far as like, what do I do, or to like reapply, or, any tips on anything like that?
Yes. So anytime a veteran files a claim, they will be, as long as it's on the prescribed form, they will receive what's called a rating decision. That rating decision will tell the veteran exactly what they claimed, what was granted, what was denied, and why. And what's key is they actually tell you what element of service connection was not met. So, for example, sometimes a veteran, they served in Vietnam. They claim diabetes, but they go to the exam and there's no evidence that that condition is diagnosed. So sometimes you get denied for not having evidence of a current condition. So What I would tell that veteran is make sure you read your letters and appeal if you're within the timelines. And moving forward, just know that you can always appeal a decision. A decision is final after a year, but you can still file after that year as long as you have new and relevant evidence. So the bottom line is do not give up, read the rating decision, and, you know, there's evidence out there that can, you know, help support your claim.
That's great. Now, I know sometimes when they get the benefit, you know, decision, I've heard veterans say, I didn't understand it. Like, I don't know what they're talking about. It's kind of like, I just know I was denied. What are your recommendations for those veterans who like need help kind of just going over what the decision was and the next steps?
I would say definitely they can always call the 1-800-827-1000 number because the representative can go over why they were denied. They can also visit our office and they can request a copy of these records to figure out why they were denied. And the key is just to get evidence and, you know, figure out the reason why that connection couldn't be made, and then get the evidence to support that claim.
Okay. Now, we talked a little bit about military spouses on the last program, and can you kind of talk us through, like, for military spouses, what it looks like for them, like attending the event? You know, does the testing, same things apply for them as well? Is there, you know, spouses? What does that look like for them?
So for spouses, there are two survivor benefits that we have. One is based on if the veteran served in wartime and based on their income, and that's called survivor's pension benefits. The other one is very important also, is called VADIC, dependency and indemnity compensation benefits. And those are important because if a veteran died from a service-connected condition, then the spouse would be eligible for compensation after the veteran's death. And what's important with that one is a lot of widows were previously denied, and because of the expansion of the PACT Act, the conditions have been updated. So if there's any widows listening, if you were previously denied, come back and see us because you may just have to reapply because now the condition is presumptive and now you may be entitled for benefits.
Great. So if, like you said, so come back, just try again, right? Go through the process.
Yes. The one thing we don't want is a veteran to be completely discouraged and feel like they don't have access to the VA because there's health care, there's benefits, there's education, there's home loans, there's so many benefits from the Department of Veterans Affairs, and I just really want veterans to know about their benefits.
You know, are military spouses also like able to, apply for benefits at the event as well, the PACT Act events?
Yes.
Okay, so they can actually apply too. Have you found what is your impression of like the process? Do you feel like the process is kind of difficult regarding the PACT Act, or do you feel like it's actually you kind of like worked out the bugs in it and you feel like, it's kind of smoother now? I know it's a process when you have something new. What do you think? What is your impression of it now as far as like the process for them?
I actually think that based on how much the PACT Act expanded benefits and based on the data of how many veterans have applied and how many were approved, the total rate of approval rate for PACT Act claims is actually 79.1%. And just to get some numbers going, there were 329,000 total veteran and survivors with completed PACT Act related claims between August 10th, 2022 and June 17th, 2023, and 279,925 of those were approved. So I think it's definitely improved and expanded eligibility and benefits to veterans and survivors.
Absolutely. Okay, good, Justyna, I heard the numbers, but what was the difference? How many did not get denied?
How many?
How many did not get denied?
So 79 got approved.
79%.
Yes.
Is it percent? Okay, 79%. Okay, I just had to rethink that number. Okay, sorry. That's awesome. 79%. That's very high. That's awesome.
That's very high, right? So
yes,
it's definitely
doing it.
improved.
Yes. So we have about 1 minute left, Justyna. So give me some closing thoughts for our audience and just, in getting these benefits and claims submitted.
I would say come out to our next PACT ACT Claims Clinic on Saturday, July 29th at the Chicago VA Clinic. And if not, sign up on VA.gov and please, please, please get your benefits in before August 9th, 2023 to receive that backdated date to August 10th, 2022.
Can you repeat the number they can call again one more time, too?
The number would be 1-800-827-1000.
Great. Thank you so much, Justyna, for being here today and sharing this great information and trying to help them not be discouraged, keep filing, and do appeals, right? All right. Thank you so much.
Thank you so much.
Stay tuned.
Bye-bye.
Oh, you're so welcome. Okay, thank you. Stay tuned. We'll be right back with more from America's Hearing Group.